Hi, I'm Dr. Eric with Right Size Right Now. Welcome to Selling Philosophy Part 2. Quick recap from Part 1. We talked about the single biggest reason why chiropractors fail or fail to excel in our profession is the fear of rejection. And when we do get rejected, the lack of effective emotional management skills necessary to kind of process that in real time. So why is this important? And the key thing to remember is that this is a dynamic that is just part of a survival mechanism with human beings, and it's actually the denial of this fear of rejection that is remarkably self-destructive. And this has led to some of the controversies that we have between the straight versus mixer, or the ongoing battle between the principle versus the therapeutic. The denial of this dynamic has wound up creating an argument that we've had for about 119 years. And the reason why we hold on to this really dysfunctional dynamic, or this really dysfunctional argument, is that it solves a problem for us. It solves a bigger problem for us within our practices, or at least we think it does. And that is that we have to sell chiropractic. Now, when you sell chiropractic, you're selling something that's precious to you, but maybe not precious to the patient until they receive the results from chiropractic. So whenever you have to sell anything, it doesn't matter if it's chiropractic or it's a widget or a car wash, ultimately all sales require a confrontation between you and the consumer. The result of that confrontation is going to be the acceptance or rejection of your goods, products, and services. And most people fail, most chiropractors fail, because they take this rejection personally. It's a pretty negative emotion to be rejected. We have a primal instinct, a primal avoidance of that. But the truth is that human beings are really poor at managing our own emotional responses. We're actually so inadequate at this, is that with emotional management, that we resort to fantasy, denial, emotional suppression, and addictive behaviors to avoid having negative feelings. Currently, if you look at the world of pharmacology, currently the most prescribed medications are all psychopharmaceuticals. They're all designed to change how people feel, so that they feel happy all the time. They don't have negative feelings. It's kind of like legalized drug addiction. So we have this thing where chiropractic is precious to us, and when the public rejects that, we wind up taking that personally. But the primary reason why the public rejects chiropractic is now and has always been about money. Now, we in chiropractic are not immune to this. We're pretty smart people, so we've created a fantasy, what I call a mutual fantasy between the straights and the mixers, that basically, the idea is if we reduce the financial barrier between the public and chiropractic, that we'll never be rejected. So let's take a look at what that looks like out in the field. So if we have this side, we have the straight side, and we have the mixer side. On the straight side, these practices typically are philosophically driven, almost mission driven. We have high volume, we have low cost. Oftentimes there's a unique or an elite adjustment that's used, like a special adjustment you can only get from that one kind of doctor. These are oftentimes non-diagnostic or non-symptomatic, kind of just following the just adjust. Again, a philosophical approach to practice. The focus is on volume. Okay, the volume of people, again, a mission-style practice, and the compromise, the economic compromise, is that there are minimal fees charged. This is where you have your $19 clinics, you have your $19 adjustments, you have your clinics that are charging on a membership rate, and there's a compromise there. Okay, where basically a lot of times those doctors are seeing a lot of people, but they're actually barely staying open. And on the mixer side of the equation, we have high per visit charges, so taking one patient and trying getting as many charges as we possibly can with those practices. Oftentimes there's a variety of services that are being offered and acting as if there was a profit center. So we have the adjustment, we have the decompression therapy, we have the laser, we have the nutritional counseling, the weight loss, blah, 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 blah. And those are oftentimes conditioned or evidence-based practices, and they're following those pain-centered protocols. So in other words, they're really doing what the insurance companies want to pay for, and that actually winds up being the economic compromise, is that you're looking at third-party reimbursement. You're in the network, you're charging $50, $60 for an adjustment, and you're getting paid $12. So again, that's a lot of rejection for both those sides, and there's a consequence to that. Then the consequence, regardless of whether or not you're a straight or mixer, is that we've engaged in the fantasy, and we've invested in this fantasy for 119 years, that if all chiropractors thought as we did and did as we do and presented as we do, then the public would suddenly get it, and then ideally they would flock to our offices, and we would be able to avoid what? Rejection, 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 once again. So we're looking looking at this as a personal issue. We have this fear of rejection that's ingrained within us. It's a survival strategy that we all share, and we're trying to avoid it on the scale, on a professional scale. And this chiropractic fantasy, really hasn't worked, because in recent years our market share has actually gone down, not up. Okay, and once again, they fail to work. The strategies have failed to work because they don't confront the single biggest reason why chiropractors fail or fail to excel in practice. And that is simply the fear of rejection, and when they are rejected, the lack of effective emotional management skills and techniques that are used to process that rejection in real time and in what I call right size, keeping things within perspective. So there's a more personal importance to this, and that is that if you don't actually deal with this dynamic within your own personal life, then you, just like our profession, will wind up into fantasy solutions. So we have all these fantasies that we come up with in terms of avoiding rejection. Do you ever notice in the bookstore how the self-help section is huge, but the just find the way you are section doesn't really seem to exist? Because the self-help section is full of a lot of fantasies, a lot of ways to avoid rejection. So there's ways that this works really well, and there's seminars, there's coaching, there's all sorts of different things. But let's just talk about these for a minute. One of my favorites, this is a picture of me firewalking quite a few years ago. And yes, I am a certified firewalk instructor, so if you all want to have a firewalk, just let me know. But I'll tell you, when you do the extreme event, whether it's firewalking or the ropes course or any kind of challenge that you're doing, the problems that you have on this side of the fire are pretty much going to be the same problems you have on the other side of the fire. You may have a burst of courage, you may have a burst of enthusiasm, but ultimately you're not going to change those things dramatically. You're still going to have your same problems. We have visualization and affirmations, and these things have a lot of value, but they don't solve the point of being afraid of rejection. You can visualize all you want, but if you don't take action and take risks, nothing's going to happen. And you can affirm things all day long, but if you don't take action, you don't take risk, nothing's going to happen. And one of my personal favorites is the law of attraction, because the law of attraction is remarkable in the sense that everywhere in physics we're taught that particles that are opposite attract each other, but in the law of attraction we're taught that things that are the same attract each other. So if I want to be wealthy, for example, I think wealth, and then suddenly wealth knocks on my door. It's actually been studied pretty objectively and proven to be a pretty inaccurate way of how things actually work. A lot of these things come from the world of coaching, okay? Personal coach, lifestyle coach, chiropractic coaches, and they're all kind of self-help tools. And once again, they have a lot of value, and applied in the right context, they oftentimes work pretty well on the short term, but they don't deal with the fundamental fear of rejection and harden you or soften you in some cases to that fear. A more pragmatic approach that some docs use is they'll go into the exclusive products or the exclusive techniques. So I'm going to avoid rejection by actually having the thing that no one else can have. So I'm going to be the only doctor with the decompression table, or the only doctor with the laser, or I'm going to have the adjustment that only I have mastered. Okay? And these are all ways that we try and make ourselves special to avoid rejection. Well, the truth of the matter is you can't win this fight. Human beings are just hardwired to avoid rejection. It's a survival skill. You look at your environment and you say, who's likely to reject me? That person over there with a club in their hand, I'm going to move away from them. Okay, you can't affirm, visualize, pray, self-analyze, or medicate yourself away from this fear. Again, fear of rejection is a survival tool. And you can't win this fight, because if you don't try, if you don't take the actions that you need to succeed in your life, you wind up rejecting yourself. And this self-rejection takes the form of self-loathing, self-criticism, poor self-esteem, and apathy. And this pushes us back into the fantasy solutions. We feel bad about ourselves, so we go back into like, oh, well, maybe I need to visualize more, I need to pray more, I need to, jump off some sort of cliff, and then I'll suddenly be immune to this. But when you can't win this fight, ultimately there has to be a solution. And the solution is you can accept the fear, assess your sensitivity to rejection. And that's a really big thing to point out. Because some doctors, some people, we have a fear of rejection in one area of our lives, but we don't have a fear of rejection in another area of our lives. So for example, we've talked a lot about selling. Some docs are really great at selling and being a good closer. And they actually have really financially successful practices. But they can't have a relationship, an intimate relationship, worth a damn. So they go through staff over and over and over again because they don't know how to be present with people. On the other hand, you have other doctors that are really good at their relationships, but couldn't sell anything to anybody. So their whole staff loves them. They have all these great relationships with their patients. They're all enmeshed and codependent, but ultimately they can't, actually sell because they're afraid of rejection on that way. So it's really important to understand where your fear of rejection on a personal level comes in. Okay, and then what you have to do is learn skills based on who you are and what actions you need to take to make your life what you want it to be, rather than wasting your time, energy, and money on fantasy-based solutions. Now, keep in mind that success takes consistent action and a two-tiered approach. The first tier is you need to be intelligent about what you're doing. You have to have a plan about what you're going to do. The second is you need to use technology. And sometimes that technology is a hard product like a computer or a phone or something like that. Other times technology is scripting, or it is a practice management strategy or technique. And then ultimately you have to have professional skills. You have to be good at what you do. There is no replacement for skill. But lastly, the thing that you really need, and the part that's missing in most of our practices and most of our lives, is effective emotional management techniques and skills. And keep in mind, all those things I mentioned before, the extreme events, the visualization, the affirmations, the coaching, the law of attraction, all those things are great, and they all have some merit. But they're all what I call first-generation self-help tools. First-generation self-help tools have been around really since the 1850s. There's an incredible regurgitation or replaying of the same ideas over and over again. The law of attraction, the first time that word was used was about 1902. So we have first-generation stuff, and the first-generation stuff are all about trying to use your brain, your intellect, to overcome, program, or sidestep your emotional body. And I got to tell you, it doesn't work, and it never has worked. It's not that there isn't some value in those things. They do have some impact, but ultimately you can't take your car to a plumber and expect it to get fixed. In other words, you can't use an intellectual tool to deal with emotional management. So what Right Size Right Now is about is really emotional management techniques and skills that will work for you. So you can get out there and take care of the people that you're supposed to take care of. So our next video, which is going to be coming up, probably hopefully in about a week, is going to be a short expose on the difference between first generation self-help, again, those are the extreme events, your visualization, your affirmation, and what we call second generation, which is what we're doing with Right Size Right Now. So thanks for tuning in. Hope you enjoyed the video. Look forward to next time. I'm Dr. Eric, Right Size Right Now.